Hi there, my name is Dr. Lindsay, and I want to welcome you to this week's webinar. This week, we're talking about managing brain fog with lifestyle medicine. And my goal in these webinars is to provide you with a little bit of education and then a few tools that you can implement today. So that's kind of for every webinar. I want to educate you, and then I want to give you a couple of bite-sized things that you can implement the day of to hopefully help you feel better or manage whatever we're discussing. That being said, I would love some feedback on what topics you would like to have on these webinars. Reminder that they happen on the first and third Wednesday of every month. And I really want to create education and information that is applicable to you. So our veterans, our first responders, family members of veterans and first responders. So if there's a topic that you would like to have me discuss and educate on, please email me. I'll put the email up at the end of the presentation, and then send me an email, let me know, comment below, whatever it is that you need, and I will put together something for you. If it's not an area that I'm comfortable with, we have a plethora of practitioners that I can pull from and get a session put together. So I really want this to be very applicable to you. So if you need something, let me know. I really want to create things that information that you need. So first and foremost, just for those of you that don't know me, my name is Dr. Lindsay Goulet. You can just call me Lindsay. I am the Director of Programming and Education at the Center of Clinical Excellence for Veterans and First Responders Health. My job is to number one, create education and present education to our veterans and first responders and their family members. We do that through these webinars, or I've been asked to come to a lot of different police organizations, firefighter organizations, paramedics, first responders, Canadian Forces, veterans associations, all of that to do education sessions. So if you need an in-person or a virtual educator, please let me know. I'm happy to create something for you in your organization and come and speak to you. So again, I'll put my contact information at the end, and you can reach out through email or through the website. I am also responsible for creating programs. So again, if there's a program that you feel like our veterans or first responders or family members need when it comes to mental health, physical health, please let me know. My job is to help create programs that are really relevant to the population that we work for. And I want to make sure that I'm working with our clients to create the right programs for you. So that's enough of that. Let's get started on learning about brain fog. And the way we're going to first start is with statistics, everybody's favorite. But there's a number of different reasons that brain fog can appear, or you'll have symptoms of brain fog. One symptom or one way is through long COVID. And we know that approximately 22% of individuals who've contracted COVID-19 report experiencing brain fog as a symptom. So this cognitive impairment can persist for months after the initial infection, and that affects attention, memory, and executive function. Now, months have now led into years. So we know that long COVID can last for quite a long time. So we want to make sure that if you do have long COVID, we want to help you manage your brain fog symptoms. We know that 1 in 5 people with long COVID indicate symptoms limit their daily activity. So this isn't just a minimal thing that's happening. This is affecting people's daily activities. And so we want to help people manage long COVID symptoms. We also know that chronic pain causes brain fog. So, brain fog is commonly reported among individuals with chronic pain conditions, affecting between 15 to 40% of this population. So, if you have chronic pain, 15 to 40% of those individuals will experience symptoms of brain fog. This is a big one. So menopause, nearly 2/3 of women undergoing menopause or perimenopause report symptoms of brain fog, which includes forgetfulness and trouble concentrating. So if you are, in your perimenopausal years or menopausal years, brain fog is very relevant to you. And again, we want to help you with the brain fog symptoms. Then we also know that there's cognitive impairments when it comes to managing PTSD. So there's There's an extensive amount of cognitive impairments, but we know memory and attention. So individuals with PTSD frequently experience deficits in verbal memory and working memory. They may also have difficulties with attention and concentration, contributing to the sensation of mental cloudiness or brain fog. Then we also have issues with executive functioning. So this means challenges in planning, decision making, and problem solving, which is also associated with PTSD patients, further contributing to cognitive difficulties. So there's quite a range of brain fog symptoms that's affected by PTSD. So how is this even concerning to you? So, well, it's really important to understand that if the best way to manage things is for you to understand it. So if we can understand where brain fog is coming from, then we can start helping you manage its symptoms in a variety of different ways. That's why it's going to be important. Now, one of the most important things that we can help you manage brain fog is to help educate you and raise awareness about what brain fog actually is. So that's what we're going to start with. So what is brain fog? So brain fog is a term used to describe a set of cognitive symptoms that can include mental confusion, forgetfulness, difficulty concentrating, and a feeling of mental cloudiness or haziness. Brain fog is a subjective experience that can vary in intensity and duration from person to person. So my symptoms of brain fog can be very, very different from somebody else's symptoms of brain fog. People who experience brain fog often find it challenging to think clearly, make decisions, or focus on tasks. So brain fog in general, if we're just going to generalize what brain fog can feel like, it would be mental confusion, difficulty concentrating, mental cloudiness. So a lot of people that I know say that sounds exactly like everyone I know. So brain fog is really, lack of focus, problems with memory. A lot of people say they have trouble finding words. So that's a big symptom for me is I lose words very, very easily. For the other day, I couldn't remember the word boots. So it's just an inability to kind of pull words. So that's that difficulty focusing, concentration. So brain fog is really a lack of like mental clarity. So how do we diagnose brain fog? Well, we don't. We can't actually diagnose brain fog. So it is a symptom. Brain fog itself is not a medical diagnosis. It's rather a subjective symptom that describes a feeling of mental cloudiness, confusion, forgetfulness, or difficulty concentrating. So that is kind of what brain fog is. We can't diagnose it. However, to address brain fog, we have to identify or diagnose underlying causes that might be contributing to it. So we can go through a process of figuring out what may be going on for you that's causing your brain fog. So we can do a medical evaluation. So you're going to consult with a healthcare professional. They're going to do detailed medical history and then discuss any medical conditions that you have or medications that you're taking, any recent life changes or stressors. So what's going on with you? Your medical profession is going to evaluate that kind of baseline information. We can also do a physical examination. So your healthcare provider may perform a physical examination to check for any visible signs or physical conditions that can contribute to cognitive difficulties. Lab tests can be done. So again, we're going to look for medical history. We can also do blood tests on thyroid. We're looking for anemia, vitamin deficiencies. Going to see if there's any neurological issues that are going on or suspected. So there's kind of a baseline medical plan that you can go through to see if there's anything kind of underlying your brain fog. Can also do a psych assessment. So if there are concerns about mood disorders, anxiety, or other mental health conditions, like I mentioned, PTSD is significant, causes a significant impact on brain fog. So mental health conditions can contribute to brain fog. So your healthcare provider may conduct a psychological assessment or refer you to a mental health professional for further evaluation. We may also do a sleep evaluation. So if sleep-related issues are suspected, you may be referred to a sleep specialist for a comprehensive sleep evaluation. So you can look for sleep apnea. Maybe you need a CPAP that's going to help with your brain fog. So a lack of sleep or lack of quality sleep is highly associated or heavily associated with having brain fog. And then a medication review. So if you're taking medications, your healthcare provider will review your medication list to assess whether the medications may be contributing to cognitive difficulties. We know that some medications do impact ability to focus or concentrate. That has an impact on memory and motivation. And then where we come in is we're going to do a lifestyle assessment. So discuss your daily routines, dietary habits, exercise, stress levels, and any other recent changes that could be affecting your cognitive impact. So your brain fog is absolutely affected by sleep, by nutrition, by movement, by stress. And so that's what we will continue to discuss in this webinar today. So most importantly, it should be if you're really interested in learning about brain fog and what's going on with you, it should be a very collaborative assessment. You should be talking with your healthcare professional, your GP, whoever you work with. You could talk to a naturopathic doctor about your nutrition, supplement, nutrient deficiencies. You be talking with a kinesiologist to be talking about your movement patterns. You need to be talking about your stress, so psych assessments, making sure that you're managing any PTSD or depression, anxiety, anything that you have to go through. So it's not like we're going to focus on one area. You need to really focus on yourself as a whole. So it really is a holistic approach when it comes to managing brain fog. So now what? So now we know what brain fog is and what can contribute to it and what can cause it, what can make things worse. Well, there's things that you can do today to help yourself feel better. And that's what I want to discuss and kind of leave you with here. Now, a lot of this stuff is going to be just real gentle reminders that it's important for you to be taking care of yourself. Because if you are not taking care of yourself, your poor brain is going to suffer and then you are going to get frustrated. And that is a very bad cycle to be in. So let's first discuss sleep. I say, my opinion is sleep is one of the most important lifestyle medicine pillars that we discuss. I am an exercise physiologist. I love fitness and working out and moving our body. But if I have a client who is asking whether they need to prioritize getting their workout in or going to bed, I will always say go to bed. Your sleep is so important and it is critical for your physical health. It is critical for your mental health. So we want to ensure that you are getting adequate and restful sleep. So what does that mean? That means we're trying to get 7 to 9 hours of uninterrupted sleep. Okay, so this is when all of my first responders start scoffing and laughing and smirking and saying there's no way they'll be doing that. I understand your job is very stressful. You're maybe a shift worker. Having that type of sleep is just like a pipe dream, and I understand that. I truly, truly do. The goal is for you to on your days off or on your swings or whenever we can is when you're really going to be trying to focus on quality sleep. It's not just the number of hours, but it is the quality of your sleep. So we want to make sure that you're sleeping well. And I know 7 to 9 hours of uninterrupted sleep is a dream for a lot of you, but that is the goal. That is the ultimate goal. Okay. And then we want to make sure that, so if you're not getting that 7 to 9 hours of uninterrupted sleep, understood, but we want to make sure that there are no sleep disorders going on, such as insomnia or sleep apnea. So if you feel like your sleep is suffering, if you are waking up from sleep and you know that you got, 8 hours of sleep, but you're still being so fatigued and so tired, you might have sleep apnea or something. So it's important to get into a sleep clinic to get yourself assessed. Okay, so that's sleep. 7 to 9 hours of uninterrupted sleep is the goal. If you're getting that, and again, you're feeling still very, very fatigued and brain foggy, then we need to get you into a sleep clinic to get that assessed. So then the second thing that we want to do is we want to try and help you manage stress. So we know that stress can impair cognitive function and lead to brain fog. So, stress management techniques such as meditation, mindfulness, yoga, and relaxation exercises can help reduce stress and improve mental clarity. If you don't know how to do any of that, please reach out and I can send you a quick sheet on how to practice mindfulness or give you some quick relaxation techniques to hopefully help de stress you and improve your mental clarity. But again, my first responders, I understand that you have a very stressful job and then home life can be very stressful as well. But we want to give you really practical tools to implement to help alleviate even just the tiniest bit of stress can help clear some of your mental fog. Okay, so then nutrition and hydration, we're trying to ensure you're having a balanced diet with adequate nutrients, including omega-3 fatty acids, antioxidants, and vitamins. So if you do not have a good nutrition plan, then we are kind of putting yourself 10 steps behind and helping you get better mental clarity. So if you're not focusing on nutrition and eating a balanced diet, then that is something that you can start doing. And if you don't know how, please reach out and we can help you with that for sure. Dehydration can also affect cognitive function, so staying well hydrated is important. If you are not drinking 2 to 4 liters of water per day, then you are going to be dehydrated, and then your brain will be dehydrated, and then you will have a lack of mental clarity, and you will have increased brain fog symptoms. So hydration is something that you can easily implement and start today. If that is not something that you're working on, might I suggest you do that? So start carrying a water bottle around. Again, if you're not a big water drinker, I understand. I also was not, but there's ways to entice you. Put some fruit into your water, lemons, limes, oranges, whatever, to make it have a little bit of flavor. You can drink it hot, you can drink it cold, you can drink it slushy, doesn't matter. You can also consider herbal teas as part of your hydration, just not coffee. Coffee does not count as hydration, neither does caffeinated teas. So we want to have herbal non-caffeinated teas. Just get the water in. It's going to help with your brain fog immensely. Okay. Where am I? Oh, hi. I'm still here. Still here. Then the one of the last things that we're going to be talking about is physical activity. Obviously, this is near and dear to my heart, but exercise has numerous benefits for both physical and mental health. It boosts brain chemicals such as serotonin, endorphins, oxytocin. I always say, when you have that lull in the afternoon between, 1 to most people have a dip between 1 and 3, where focus and mental clarity is really decreased. The best thing you can do is get up and move your body for 5 minutes. Go for a walk, go visit somebody, get outside, whatever, do high knees for 30 seconds and squats for 30 seconds or whatever it is that you're going to do, but you're going to want to try and do some sort of physical activity for at least 5 minutes. It truly can just be a 5-minute walk. And then you'll be able to come back if you're at a desk, come back and have better focus, better mental clarity, better concentration for the rest of your afternoon. So, and that is because this does boost the brain chemicals that help us focus. And really, what we're looking for is an improved blood flow to the brain. That's what's going to happen when we start doing physical activity. It just helps the brain get oxygenated, it gets more blood into the brain, it helps us focus. So that's the goal. Ultimately, what we're looking for is 3 30-minute sessions per week. Now, that's minimal. I would love to be seeing people doing at least 5 30-minute sessions of dedicated fitness per week. This means dedicated time where you're like, I am moving my body on purpose to help me feel better physically and mentally. So, walks, hikes, dedicated group workout sessions, whatever it is, we want you to be doing that at least 3 times a week, if not 5. If you're not an active individual, that's totally fine. We're going to start baby stepping it. So, you're going to do, 5-minute walks every day, and then you're going to boost up to 10. And then eventually, you're just going to increase until you're meeting the minimums that is required for your age. And then other lifestyle modifications that we would like you to implement is to limit alcohol. Alcohol has a real significant impact on brain fog. Um, Limit caffeine, of course. We're going to reduce exposure to environmental toxins. We're going to maintain a consistent daily routine. And then, oh, I'll just go back here for a second. So these are just kind of like a few things that you can start thinking about. Alcohol is a big one. Caffeine is really, really big. Caffeine can have a significant impact on your sleep if you're drinking it way too late in the day. So we always say, or I always say, try to have your caffeine before 11 or 12. Listen, I know my first responders are like, nope. Not when I have a night shift or whatever it is, but these are on the days that you're not working. So we really want to try and limit your caffeine, well, always, but on the days that you're not working, really be cognizant of it. And then the part about maintaining consistent daily living and daily routines is that we do get into certain habits, and that does actually help with brain function. So having those nice dedicated times and that nice schedule where the brain and the body kind of know what they're doing throughout the day is really helpful to help you manage your schedules and organize your days. Okay, so this is brain fog. We have a brain fog program at VFRH. It's available to veterans, first responders, and family members of veterans and first responders. It's a 12-week virtual program, so you don't have to worry about coming into the center. Everything is done virtually. It's a 12-week program. It has weekly 60-minute education sessions. You have one-to-one sleep coaching, and then you have nutrition and fitness resources available. We do have a wait list going, and you can check us out at bfrh.ca/brain fog if you want any more information on the brain fog program. It is a really great program. There is a ton of education. The feedback on this program is incredible. I've had such a good time with every single participant in the brain fog program. So if you have questions about it, if you need anything from me, please don't hesitate to ask. I would love to help you. There's the phone number that you can call and talk to our health concierge. She can help you kind of figure out what programs might be best for you. If you have any questions about education sessions or about brain fog or the programs that we have, there's my email for you. You can throw me an email. And then, of course, if you need any information on all of the programs that we have available, it's vfrh.ca. We are going to be expanding our offerings across Canada now, which is very, very exciting. New locations starting in the Maritimes and in Ontario. So stay tuned for more information on that. And then again, if you have suggestions on topics that you'd like for these webinars, please let me know. I would love, love, love to hear it. And I would love to help you out. Take care. And again, send me an email if you need anything. I hope you have a great night. Take care of yourself.